Hello everyone, I'm Anthony D'Souza and welcome to this series of videos on the exciting world of healthcare science.
Hello, my name's Asher Foyle. I'm a senior medical photographer at Great Ormond Street Hospital. As a medical photographer, we photograph and video patients in our studio here, on the wards, in the theatres. It'll vary from department to department, but here we will do the clinical photography and video, but we're also involved in doing motion graphics that we'll use as part of the video presentation. We'll do some print graphics and public relations photography for the hospital. The patients will be in the reception. There'll be a request on our EPIC system, which is the patient record system. We'll get the information from the clinician in terms of what the request's for. We'll bring the patient in and we'll photograph the areas that are required or video the areas that are required. So we use 5D Mark IV cameras for most things. We have the Bowens lighting system, racking system, so they're very flexible. We used to have them on stands and people tripped over them, now they walk into them. But they're a better alternative than the stand. We have backgrounds, so we have like white, blue, we've got green for green screening for video. And it's very flexible. It's not huge, but it does everything we need. Even for, sometimes we need to film somebody walking to show their gait, and so we've got enough room to do that. Well, let me tell you the departments we work for mostly, shall I? So there's plastics, dermatology, cleft lip and palate, rheumatology, ophthalmology, a variety. I did a BTEC course and then I went on to do a degree in photography. I worked for many years as a freelance photographer, mostly kind of like portraiture work, editorial, but some annual reports for like city firms, things like that. I got fed up with being a freelance photographer, and a friend of mine who'd been working up in Manchester said, you might like this job. So I was fortunate enough to get the job, and then I did some post-degree training to give me some specific background to the conditions that we see and how to approach them, how to deal with clinicians' requests, etc., etc. The first thing you would want to do is you want to go to the IMI, that's the Institute of Medical Illustrators website, and you'll find all the information required there in terms of like qualifications, trainings. We'll tell you the various routes into it, but principally you really want to be doing a degree in photography. We have a standardised workflow for patients who are going to be treated over many years, so we need to have very standardised photographs. We want to really be concentrating on the changes rather than, we don't want different lighting, for example, we don't want different views, we want to be able to just see the changes that are being made by principally the surgery. So if you could look straight ahead for me, that's grand, thank you. And now if you'd be kind enough to tilt your head back. Typically we'll do some facial views. Depending on the condition, it will determine how many photographs and which ones that we'll take. I've been here now for 18 years. I said 5 years, I don't know why, but we've had changes of management, changes of location, everything, so it's always been interesting. So I thoroughly recommend it.